Welcome back to my channel, guys. Thank you so much for the immense love that you have been showing to my podcasts. But today, it's not the usual video that you see. It's not a podcast that you're talking today about. It's a topic that is ongoing in the news a lot right now. So, January 2020, when for the very first time, India and United States have spotted their COVID-19 cases.
Hundreds dead, thousands infected across multiple continents, millions quarantined.
Rolling back the time forward, 5 years from then, January 2025, again, both these countries, as a matter of fact, the whole world is now again questioning, are we going to have another pandemic? If I have to sum up what's going on right now, I would say 3 words: fear, panic, and confusion. Are we going to have another COVID-19 like breakout? Are we going to have another deadly virus just like COVID-19? Is it leading to another pandemic? Are the burial grounds and hospitals are overwhelmed by this mysterious virus outbreak in China? Stay with us as we talk more about these facts. Let's dissect this topic and know how much of this is a fact and how much of this is fear mongering. On that note, we are now trying to break down the topic called HMPV, Human Metapneumovirus. As I've previously mentioned, from the history of COVID-19 that the world have faced, I do understand the fear that is brewing in the world right now, the constant pressure that and the flashbacks that they're having, kind of nostalgic feeling they're living through, that the same time period of January 2020 and January 2025, we are looking at conditions that are being similar with China, and all of a sudden a new virus outbreak that's happening. Putting the pattern of time aside, let's talk what exactly is HMPV is as a virus. HMPV, the Human Metapneumovirus, is a respiratory virus that typically causes symptoms like coughing, fever, nasal congestion, and shortness of breath. Very similar like to COVID-19. Yes, I do agree. But the fact is this virus is not new. As stated by WHO, it was first identified in Netherlands in 2001 for the very first time. And this virus was initially found in birds as AMPV and later on adapted by humans, which we today call as HMPV. And as CDC from United States have mentioned, annually 20,000 children who are under the age of 5 get hospitalized due to this virus, and majority of them have the symptoms very, very mild and discharge or recover from this virus within a span of a week. With that being said, let me address the main question that the world is right now having. Is HMPV the next pandemic that we are witnessing? Before we enter into that question, let me actually mention a few numbers for you, both from India and United States. First covering the Indian numbers. So there are 7 cases of HMPV that are already reported, in which most of them are infants. These are from the cities Bangalore and Ahmedabad. Talking that aside, one of them have already cured from it, is what the news that we get from India. And talking about United States, we have pretty good numbers here. So HMPV cases have been steadily increasing since November, but they remain low. So according to the CDC, out of 13,800 people tested for respiratory diseases during the week of December 28, 18.71% of them were tested for influenza, which is a common flu-like virus here. And we have positives of 7.1% for COVID-19, while HMPV remains for 1.94%, which is relatively very, very low. Talking about the statements by the health ministry from India that have mentioned it, that this is not our pandemic, or at least a situation that people should be worried about. So they have mentioned two things that I would like to primarily state. One, they said this is not a virus that they're seeing for the first time, as I've mentioned, and they are not really worried that this will cause a very big outrage in India or a problem in India, because with the introduction of what a pandemic looks like through COVID-19, the government have said they are ready to face even if it's a pandemic, but they are not counting this as something that will cause potentially a pandemic level issue. Point number two, Veena George, the health minister of Kerala, have mentioned that HMPV is something they have seen being around for the last so many years as a virus, and was tested positive in multiple years from the last few decades, and not something that the India is looking at for the very first time. Coming to United States, they have also mentioned that it's not the first time that they're looking at these cases. So it's really false if you are hearing it from any source that this is the first time they're looking at HMPV as a virus. Point number one. Point number two, COVID-19 and HMPV are very, very different viruses, despite of their symptoms and targeted organ being same. Targeted organ being lungs. HMPV is, unlike COVID-19, a stable virus, which means there is no rapid mutation of this particular virus. After all these facts, you can just simply comment down, or, if I'm sitting with you right now, you can just ask me one question, that is, hey, Anudeep, wait. We do get these facts, but why a sudden rise in China then? Coming to that question, so I got so right now you must be seeing on the screen a 10 years study that was published in International Journal of Infectious Diseases, which states a relationship between meteorological factors with HMPV rise. It is clearly stated in the report that in specific to Hong Kong, spring and summer, and in specific to the other regions, spring and winter, as being the seasons where there is a peak rise of HMPV viruses being positive. Also, it is mentioned that sunrise or sunshine being correlated to the virus spread. The higher the sunshine, the lower the HMPV positive cases have been noticed. While this report have its own limitations, as out of 524 samples, only 54 of them were positive samples. With that limitation being in head, the report clearly states at its conclusion that this can be a good understanding of how meteorological factors do affect HMPV. So looking at that, you can clearly identify the correlation that right now, with the season being winter across the globe, the rise of HMPV virus is on peak right now in China, and that's the only reason why we are hearing the news from China coming down that it's on peak. There are too many cases right now. Point number two that I want to state about is, as I have said before, are burial grounds being overwhelmed, hospitals being overwhelmed? Well, there are increased cases. There are so many of them, people coming down to the hospitals. They're trying to get cured as quickly as possible, and China is handling the situation from their side. And Chinese government have also mentioned that all the world are looking at them, saying that they don't give the news. They did come out and tell that we don't see this whole thing as a scenario where you have to be worried. That's the reason why we were not really making a statement about it. Yet the things are controlled, is what Chinese government have mentioned from their side. With that being said, there is no significant evidence to prove that the burial grounds are being overwhelmed or the death toll is high. But yes, Chinese government have mentioned that there are reportedly too many cases right now from their side. And with the spread being around also in India and United States. So now coming to a keen factor that a lot of people have not stated yet to you guys. So the cases that are reported from India have no travel history to provide evidence that it comes or origins from China, which means the case that was spotted in Bangalore or Bengaluru for the infant has no travel proven history to prove that it comes from China. Similarly, in the United States, there are not the cases that have been spotted positive have any travel history right now or minimal travel history and no correlation or direct correlation to China, which specifies again that it is just a weather oriented or meteorologically factored virus spread, not a pandemic. Don't expect to be home again. Don't expect to be having a lockdown again. Don't expect your colleges to be shut down again. I heard that Amazon have got their 5-day work policy back just this morning. So all the software engineers and everybody who's employee of Amazon, you're going back to office. And everybody else in the world, if they're having 5-day office works or any part of your employment requires you to be on site, you are being on site. You're not being home. It's heavily impossible that this will be turning into a pandemic. It's not going to be such kind of a thing yet. With China, it's always a tricky situation there. You never know. They have stated similar kind of things when COVID-19 have happened. So right now, one thing I would tell you is a very old saying of English that my English teacher used to note multiple times, which is prevention is better than cure. So few of the things that you could take care of to avoid HMPV virus spread or attack is wash your hands frequently, cover your mouth while you're sneezing or coughing, make sure you don't touch your face after coming into contact with any of the surfaces or other persons. Avoid close contact with sick individuals and wear a mask. I don't know if it is required, but it is suggested by WHO that wear a mask while you are expected to be in crowded places or poorly ventilated spaces. These are the few things that you can follow to avoid. And in case if you feel you're infected, please do reach out to a medical professional and get help as quickly as possible. And hydrate yourself and take care of yourself. And this would, of course, reduce the risk of spreading the infection or getting infected, both. I would like to talk to my Indian audience. अगर कोई भी आप ये वीडियो देख रहे हो और आपको ये वीडियो को मम्मी पापा को दिखानी है तो या दादा दादी को दिखानी है या किसी को भी दिखानी है, मेक श्योर आपके लिए बहुत सिंपलिस्टिकली बता दूंगा, ये ऐसा कुछ नहीं है कि नहीं ये हम लोग कुछ नया देख रहे हैं इस दुनिया में. ये बहुत पुरानी वायरस है, 2001 से इस दुनिया में मौजूद है. एंड इसका कोई स्ट्रेस लेने की या कोई टेंशन लेने की ज़रूरत नहीं है. ये अभी चाइना में वातावरणिक रीजंस की वजह से बढ़ रही है. एंड इंडिया में भी अभी और यूनाइटेड स्टेट्स में भी, अमेरिका में भी हमको देखने को मिला है. पर इसकी कोई डायरेक्ट कनेक्शन नहीं है चाइना से ये बोलने के लिए कि हाँ ये चाइना से ही आ रही है या स्प्रेड हो रही है. लेकिन फॉर योर ओन सेफ्टी, हमारी अपनी सेफ्टी के लिए कृपया अपनी ध्यान रखें. कहीं पे भी जा रहे हो अपनी हाथ धोए अच्छे से. अपनी मुंह पे या चेहरे पे किसी चीज़ को छूने के बाद अपनी चेहरे को सीधा ना छुए. कोई भी क्राउडेड जगहों पे रहने जाने वाले हो या बहुत कम वेंटिलेशन हुए होने वाली जगह पे जाने वाले हो तो कृपया अपनी मास्क पहने. एंड कोई भी आपको लगता है या पता है कि बीमार है तो उससे थोड़ी दूरी रख के रहे ताकि आप इस वायरस को स्प्रेड होने से या आपको इन्फेक्ट होने से बच सके. ऑन दैट नोट, एक छोटी कंक्लूजन, आई मीन अ स्मॉल कंक्लूजन टू एवरीबडी, that this is not the first time that we are looking at this virus. And I personally feel with the introduction that COVID-19 have given to us, I am pretty sure that the world is surely ready for no matter whatever the epidemic or pandemic that we're looking at. So don't really panic, don't really be confused, don't really have your fear being grown just by looking at these headlines or news channels. As I have said, make sure you take care of yourself, take care of your elders, take care of the kids that are in your family. It's as it also mentions, it's only mostly targeting the kids who are under 5 years old or over the age, which again, or anybody who falls into the region of having a weaker immunity or weaker immune system, or they call it as immunocompromised. So if you fall into the category of that, make sure you are taking care of yourself immensely. Else, most probably you already have an immunity to this virus, so don't really worry about it. It's not me saying, it's WHO saying, it's CDC saying, and it's Indian Health Ministry saying that this is a fact. So don't worry. Hopefully you are safe, and you will be safe. And let's all pray for China that they come out of this epidemic as strong as they are. And hopefully the people of China will be healthy and will be safe. And on that note, I would like to just say, for more such content, make sure you like and subscribe. And some of the podcasts are coming soon. So stay safe, stay healthy, stay hydrated, and watch Take the AK experience. Thank you so much, guys. I love you all, and I'll see you in the next video.